Globally, the International Labour Organization, the ILO, in their World Economic and Social Outlook Trends 2021, noted that the COVID-19 pandemic has caused unparalleled disruption worldwide through the devastating impact on public health, employment, and livelihoods. In 2020, 8.8% of the total working hours were lost globally, the equivalent of the hours worked in 1 year by 255 million full-time workers. The total employment fell by 114 million, and 30 million jobs that would have been created in 2020 were never created. The global shortfall in employment, therefore, increased by 144 million, and the working poverty rates have now reverted to those in 2015. FKE, therefore, calls upon all policymakers to continue to, 1, strengthen our healthcare systems and supplies. 2, to observe COVID-19 health protocols and guidelines. And then 3, scale up the vaccination program. On this, we urge the government to improve the supply chain systems to make vaccines more available, and further to involve the private sector and businesses in the education and sensitization of the public on the benefits of boosting immunity through vaccination.
Overall, we would say that the employers and business in particular is really not operating at optimal levels, and what you see happening on the global scene is a reflection of what's happening in Kenya. We had the UN resident coordinator talking to us as our chief guest at the AGM we've just had. And he was saying the pandemic is a global issue. It doesn't know borders. So what's happening in Indonesia right now is pretty much having an impact on Kenya and other parts of the world in varying degrees. So speaking on behalf of the labor sector, we can say that a lot of effort was made by the social partners through coming up with a memorandum of understanding and parties talking together to retain some level of normalcy, but enterprises are in distress. There's some slight improvement from what we are seeing in terms of response from our members in the last 6 months or so. So there's a window of hope, but we're nowhere near where we were pre-COVID.